Hello, dear friends. I've just arrived from New York and I'm settling into Sao Paulo. And I wanted to announce to you something that's very close to my heart and I feel is the most important tool for becoming effective in the use of Ericksonian hypnosis and the deep level of communication that you've been studying. And that's supervision. In all of my trainings, what I really found is that the supervision, which enabled me to realize my reaction to the client, was one of the most important things for determining how I was going to approach the client, and it allowed me the richness of my interaction to factor in to the intervention that I would use that would be most effective for my client. So supervision to me is very important. We'll be having two-day supervisions in this year, and I would love to see you at both. It doesn't mean that you have to have 1 million patients, even if you have 1 or 2 or no patients. Listening to the other people and their patients is a very rich experience. It's actually what I just said. What is my reaction when I hear somebody presenting very, very important information? What I found is that where I was stuck, either denying what the client might be triggering in me or what the client was saying that had an echo of my history, where I was stuck, the client was going to be stuck. The client wouldn't move beyond that point. And so what I valued most in all the types of supervision that I had is when the supervisor helped me to overcome where I got stuck and helped me to really listen in depth so that I could utilize what the client was saying in the best possible way. You know, there's a wonderful video of Milton Erickson, and a very intellectual psychologist said, well, Dr. Erickson, who and what should I study with to be the best Ericksonian hypnotherapist I can be? And I would also add to that, the best communicator I could be, because whether you're doing therapy or not, really being a good communicator is one of the major keys to life. And Erickson sort of thought for a moment, and he said, to be the best you can be, know yourself. So the way I do supervision is you may have a very short, concise presentation of the case, but then we're looking for where you're stuck. We're going to be using role-playing. We're going to be using the sensitivity of the whole group, because there's a lot of information in the group that might be helpful to you, and to help you to expand your capacity rather than analyzing or trying to find a solution or trying to reprogram the patient. So supervision for me, and when I supervise you, I think you'll find we will co-create an environment where it becomes an internal, ongoing supervision so you can become better and better at what you do. And that's my goal. And I'm sure it's yours as well. See you in supervision.